Hi, my name is Charles Sweeney and I'll be doing the oral medication demo. First thing I'm going to do is I'm going to spray down our med cart with disinfectant, ensuring it's nice and clean. Med cart's clean. I'm going to sanitize my hands, wash my hands. So right now it's 8 o'clock in the morning and we're going to do morning meds. So I'm going to go look at the MAR, see who needs their medication. Today at 8 o'clock, Joe Milton. He needs to take his risperidone, 2 milligrams or 1 tablet. Cool. I'm going to find the risperidone in Joe Milton's medication box. So I'll open his medication box and I'll pull out the risperidone. So I'm just going to complete my first check here. I'm going to ensure that yes, Joe Milton does take risperidone. So it's Joe Milton on the pill bottle and risperidone on the pill bottle. Again, risperidone on the MAR. 2 milligrams for 1 tablet. Again, this is a 2 milligrams. So no calculation is necessary. We only need to take 1 tablet. And again, it's the right time, 8 o'clock. So we got the right medication, the right person, and the right dose. So that's our first check completed. Next thing I'm going to do is I'm just going to make sure I have all the proper supplies I need. So I'm just going to grab a little med cup to dispense the medication into, and then grab a glass of water for Joe Milton to have with his medications. Okay? So I've done that. Next thing I'm going to do, if I had any questions about this medication at all, I would refer to a drug manual if I needed any further information on risperidone. So I'm going to perform my, I'm going to do my 7 or 10 rights right now. So we know we have the right person. So it's Joe Milton on the MAR, Joe Milton on the pill bottle. We have the right medication. We know it's risperidone. We know we have the right dosage. So again, this is 2 milligrams for 1 tablet. Again, these are 2 milligram tablets as well. So we only need 1 tablet, no calculation necessary. We have the right route. So these are oral medications or pills. And again, it says here 1 tablet or orally, morning and evening. So now we have the right route. The time and frequency, we know because of the MAR, Joe Milton takes this at 8 o'clock in the morning. And so we have the right time. We're going to document after all this is done. As well, Joe has the right reason to take this medication. So maybe Joe has a psychiatric disorder that he needs risperidone for. He has the right to refuse as well. So when we go to his room, he can refuse this medication. He has the right to be educated on this medication as well. So if he has any questions, we can provide that for him. And again, he has the right to an evaluation or drug interactions. So if there's any drug interactions that have been found in the past or he's having, we can evaluate that. So those are the 10 rights, all done. Next thing I'm going to do is I'm going to perform my second check before dispensing the medication. So again, on the MAR it says Joe Milton, medication bottle says Joe Milton. We have risperidone, 2 milligrams for 1 tablet. This is 2 milligrams, 1 tablet. So we have completed our second check. Perfect. So now I'm going to dispense the medication. So I'm going to open the top of the medication bottle, and I'm going to dispense 1 tablet, 2 milligrams, and I'm going to place it into medication cup. I'm just going to set that aside, and I'm going to put the lid back on the bottle. Before I put this bottle away, I'm just going to ensure my third check. So again, we have Joe Milton, risperidone, 2 milligrams, 2 milligrams. Perfect. Third check completed, so I can lock this medication back up in the cart. So I'll put that medication away. Awesome. So I'm just going to make sure there's some water in the cup for Mr. Milton, and then I'm going to grab the medication as well as the water, and I'm going to head over to Joe Milton's room. Just before I enter his room, I'm just going to clean my hands off one more time, knock on the door, I'm going to enter, I'm going to say, "Hi Mr. Milton, my name is Charles, I'll be your psychiatric nursing student today. Can you please tell me your full name?" And he'll reply to me with the correct information. As well, I'm going to check his wristband, ensuring that he is who he says he is, and I'm going to confirm that with Amar as well. So Joe Milton is who he says he is, so we can ask him, does he have any questions about this medication? Does he want to take it? And he is okay with everything. He has no questions, and he's willing to take his medication. So I will give him the medication, the water, he'll take his meds, and I'll throw out his medication cup. I'm going to perform hand hygiene now, so I'm just going to clean my hands off one more time. I'm going to ask if Mr. Milton needs anything else, and he seems fine, so I'll tell him to be back to check on him in 15 minutes or so. So I'm going to head back to the med cart at this point, and I'm going to document. So I'll grab my handy dandy pen, and I'll look at the 8 o'clock spot on the correct date, and I'll sign off that Mr. Milton has received his 8 o'clock medication. Perfect. And thank you very much.